What causes the implant crown to be out of occlusion?
Why did the questioner's implant prosthesis have such a large error? Identifying the cause is like finding the culprit in a mystery novel. This is because we are trying to figure out who committed the crime, and why, and with what weapon. Just like a detective looking for clue, let's look for a list of suspected culprits in the questioner's post. The most likely suspect is always the scan body. A peak scan body was used during the scanning process in this case. The job of scan body is to transfer positional relationship data from the mouth to a data file, during which time there are opportunities for various errors to occur. Examples of such errors include the improper connection of the scan body, errors during the matching and merging process, and mistakes in choosing the wrong pre-milled titanium blanks. All of these and more can cause vertical errors. Many users gave their opinions on what the problem was. Some had the opinion that this was an error caused by the peak material scan body, and this error would not have occurred had a metal scan body been used. Others believed the technician may not have been paying attention and matched the wrong size. Or, the dentist must have overlooked the misfit of the scan body. There were many hypotheses provided, and each one of those made sense. But we need to really consider if such factors can cause an occlusion error close to 1 mm. We need to check the range of error that various suspect factors can cause. By doing this, we can rule out the suspected criminals one by one. We will begin revisiting the process of producing a prosthesis through a scan body. The steps involved in making an implant prosthetic with the use of a scan body is as follows. Step 1. Connect the scan body and take an X-ray. Here we have to check if there is any misfit. Step 2. Scan the scan body. No deformation should occur during the scanning process. To do that, choosing the right size scan body is very important. To be more accurate, you can take advantage of the Medit software. You can register the specifications of scan body in advance so that matching will occur simultaneously with the scan. Step 3. Send an online order to the dental laboratory. Make sure the right sizes are specified in the request form. If all this is done right, then there should be no errors from the clinic side of things. Now on to step 4, which is in the hands of the laboratory. The laboratory will check the file and match the scan body to produce the final prosthesis. In fact, errors can easily occur in this process because there could be discrepancies in the matching and merging depending on scan data quality. These errors are preventable if you had matched the scan body on Medit link in advance. The important aspect in step 4 is communication. At our clinic, if the technician feels that matching is imperfect, we do not manufacture a final prosthesis, but only a temporary crown made of PMMA material. We do one additional scan for the custom abutment in an attempt to achieve a more accurate result. If the occlusions seem to be even slightly misaligned, the technician should not proceed without consulting me. In other words, there should be an open line of communication between the technician and the dentist in step 4. If we assume that Dr. Nguyen did everything perfectly as he stated, then the mistake probably happened on the dental technician's end. How much damage can each individual suspect cause? Let's assess this. We actually found a paper that said that peak material scan bodies can cause errors. In this paper, the results showed that it can cause errors depending on the strength of the tightening torque. For example, if we tighten it with a force of more than 20 Newton centimeters, the scan body will dig in more deeply, and some vertical error may occur, resulting in prosthesis that is out of occlusion. The range of error that would lead to a clinical significant difference was found to be about 100 micrometers. However, in Dr. Nguyen's case, the error was about 1 millimeter or more, so the material is innocent. It cannot be blamed for this occlusal error. The takeaway from the paper is that the recommended force to tighten with is 5 Newton centimeters, which is a comparable force of that used to tighten the healing abutment. Then, how much vertical error can occur during the matching and merging process? This will vary significantly depending on the quality of the scan data. Let's look at a situation when trying to match, but it's not matching well. What would happen if the dental technician made unilateral decisions and worked arbitrarily during this process? A vertical error of up to half of the scan body's D-cut depth can occur. It could be up to 0.4 millimeters. However, usually, if the matching does not fit in this level, the dental technician would definitely consult with the dentist, if he is normal. Therefore, it is unlikely that this is the cause. The next suspect is the matching and merging process. How much of the scan body needs to be exposed to cause less deformation? When looking at papers related to the accuracy of the scan body, various factors such as the length, shape, and scan quality of the scan body can have an impact. According to the research article, if not enough of the scan body is exposed for matching, errors can occur during the alignment process. Therefore, it is important to select the scan body with the right amount of exposure to prevent alignment errors. In the case of Dr. Nu Win, although he didn't state the size, it might have been a posterior molar, and due to the distance between the teeth, a shorter scan body might have been used. If so, this could have been the cause for the occlusion error. Furthermore, the method of matching, whether using 3 points or 1 point, can also make a difference. Therefore, the matching and merging process is very important, and there is a high probability of errors occurring, so technicians need to pay close attention to the process. Despite errors being relatively higher at this stage, they are not extreme to the extent of 1 mm as in the case of the questioner. No matter how many research papers we went through, we couldn't find any convincing suspects. In the end, the only possible cause for millimeter scale errors was attributed to what had occurred in our clinic. Specifically, it could only result from either incorrectly stating different sizes during the clinic stage or mismatching different sizes during the lab stage in the aligning process. However, according to Dr. Nu Win's best recollection, there were no documentation errors, so the case remains a mystery. So what on earth was the culprit? Interestingly, the questioner himself revealed the culprit. The culprit was in a different place than we expected. An error occurred during the process of matching and merging, but it was due to user input error. This falls under Step 3 of our classification, but Step 4 also comes into play because the technician could have told him that the matching process is not normal. It shows how important communication with the technician is. Thanks to Dr. Nu Win's persistence and patience in analyzing this, we were able to finally close this case. I want to emphasize once again that if there is a faulty prosthesis, it is important to find the culprit through joint investigation between dentist and technician. So, if you encounter this kind of situation, try not to get frustrated and use this flowchart to help you find the culprit. However, the best thing to do is to take the preventive measures so that such situations could be avoided altogether. We have summarized the preventive measures we introduced today. In Step 1, do not tighten the scan body with too much force. In Step 2, choose a scan body with an appropriate amount of exposure and match it in advance on the Medit link program. In Step 3, verify once again that the information is accurate before ordering online. In Step 4, if anything unusual is observed during the matching and merging process, the technician should communicate with the dentist immediately. If you stick this on your desk and use it as a checklist, you will be able to get a much more accurate implant prosthesis consistently. Good luck to your dental team. This is the answer to question number 1.